High blood pressure, also known as hypertension, affects millions of people worldwide, often without any obvious symptoms. But what causes blood pressure to rise, and what can you do about it? In this video, we'll explore the main reasons behind elevated blood pressure and share simple strategies to help manage it and keep your heart healthy. Ready to take control of your blood pressure? Let's dive in. Before we talk about why blood pressure rises, let's first understand what blood pressure is. Blood pressure is the force of blood pushing against the walls of your arteries. It's measured in two numbers: systolic, the pressure when your heart beats, and diastolic, the pressure when your heart rests between beats. A normal blood pressure reading is around 120/80 mmHg. When was the last time you checked yours? So, why does blood pressure go up? Several factors can cause your blood pressure to rise. Let's look at some common ones. A diet high in salt can make your body retain more fluid, putting extra pressure on your arteries. When you're inactive, your heart works harder to pump blood, which can increase blood pressure. Do you get enough physical activity during the week? Chronic stress leads to elevated levels of stress hormones, which can cause your blood vessels to constrict and your blood pressure to rise. Smoking damages your blood vessels, making them stiffer and narrower, which increases pressure. Your genes can also play a role. If high blood pressure runs in your family, you might be more prone to developing it. So, a combination of diet, lifestyle, and even genetics can affect your blood pressure. But here's the good news: there are effective ways to manage and lower it. Let's talk about how you can manage and lower your blood pressure. It might seem overwhelming, but small, consistent changes can make a big difference. First, let's start with dietary changes. Start by cutting back on salt. Processed and fast foods are often loaded with sodium. Try to keep your daily intake between 1,500 to 2,300 milligrams. Have you checked the sodium content in your favorite snack lately? Potassium helps balance sodium. Foods like bananas, spinach, and sweet potatoes are great sources and can help regulate blood pressure. The DASH diet, or dietary approaches to stop hypertension, is specifically designed to lower blood pressure. It focuses on eating more fruits, vegetables, whole grains, and lean proteins, while reducing fats and sugars. Alcohol can raise your blood pressure, so try to keep consumption moderate, no more than 1 drink per day for women and 2 for men. With the right food choices, you're already on the right track. Now let's talk about the importance of exercise. Exercise is another key to managing high blood pressure. Aim for at least 30 minutes of moderate physical activity most days of the week. How many days this week have you moved your body? Activities like walking, jogging, cycling, or swimming are all great ways to get your heart pumping and lower blood pressure. Adding strength training a couple of times a week can also help maintain healthy blood pressure levels. Managing stress is just as important. Chronic stress can lead to spikes in blood pressure, so learning to relax is essential. You can try meditation, deep breathing exercises, yoga, or even mindfulness techniques to keep stress in check. Have you tried any of these yet? Getting enough rest is crucial. Studies show that poor sleep is linked to high blood pressure, so aim for 7 to 8 hours of quality sleep each night. Maintaining a healthy weight is another major factor. Even losing a small amount of weight can significantly impact lowering your blood pressure. On average, losing just 1 kilogram can reduce your blood pressure by about 1 millimeter of mercury. If you smoke, quitting is one of the best things you can do for your blood pressure and overall health. Smoking damages your blood vessels and significantly raises blood pressure. Also, be mindful of your caffeine intake. Some people are more sensitive to caffeine, and it can cause temporary spikes in blood pressure. It might be helpful to monitor your coffee or tea intake. For some people, lifestyle changes may not be enough, and medication might be necessary. If your doctor prescribes medications like diuretics, ACE inhibitors, or beta blockers, make sure to follow their advice. It's also a good idea to monitor your blood pressure at home. This helps you track your progress and see how well your efforts are paying off. Managing high blood pressure might seem overwhelming at first, but remember, small, consistent changes add up over time. Whether it's diet, exercise, or stress management, each step you take makes a difference. Thanks for watching. If you found this video helpful, be sure to like, subscribe, and share it with others who might benefit from these tips. Stay healthy and take care.